The curiosity, creativity, and drive of military medical researchers offers promise that we can overcome some of the biggest healthcare issues facing our military service members, veterans, and their families today. These leaders find reward in their pursuit of the myriad of challenges affecting healthcare today. Geneva calls these military medical leaders our researchers to watch. Here are a few researchers who specialize in combat casualty care. Colonel Jennifer Gurney was funded $1.1 million for a study to improve resuscitation strategies and decrease preventable death from hemorrhage during combat. It is important that the process be reevaluated to improve battlefield care through performance improvement and directed research. Lieutenant Colonel Dr. Christopher VanFossen is leading an observational study for the Role 2 forward surgical teams to reduce mortality among critically injured combat casualties with timely and optimal care. The goal of the study is to prepare clinicians for their deployed mission on the future battlefield and to minimize preventable combat deaths. Dr. Amanda Stout is conducting the first study of its kind to provide better treatment to service members who have had a traumatic eye injury during combat. In her study, she proposes the creation of an algorithm to inform a treatment requirements timeline in a prolonged field care setting to reduce the number of patients with loss of visual acuity. Dr. Sujith Sajah has spent over the last decade investigating blast effects using state-of-the-art MRI technologies, preclinical models, and translational studies to understand and prevent risk against warfighters following blast trauma. He received a $2.8 million award to develop injury risk metrics to assess the effectiveness of explosive ordnance disposal bomb suits as countermeasures to primary blast. Dr. Andrew Bachinski and his team at the Arriva lab are pursuing groundbreaking treatments for the management of acute respiratory distress syndrome and is pioneering advancements in extracorporeal life support, focusing on combat and civilian trauma and novel critical care interventions. We recognize and honor our inspiring researchers and research teams who are leading the way in pursuing innovative solutions that impact military and global populations. The Geneva Foundation, the future of military medicine today.